Isn't it interesting, as we grow older, we start putting the puzzle pieces together of our past to figure out where we are now? I should probably start out by saying that I myself have a gluten sensitivity, but I didn't find this out until I was 31 or 32. Now, the way that I am affected by my gluten sensitivity is my mental health. It contributes to depression, anxiety, brain fog, ADHD. Moving on to my next point, I had colic as a baby, and I did not know that there was any type of correlation with this, although it does make sense. But it was after stumbling through some research in the paleo community, in the autoimmune disorder community, and within the functional medicine ancestral health sphere that I started to put this puzzle piece together. So as I said, I myself had colic as an infant. I would just cry hours upon hours. I also had intolerances to cow's milk, so I had to be fed with goat's milk. Now later on in childhood, I drank cow's milk just fine. Now it's important to note that there aren't epidemiological studies out there that show this really clear evidence that, oh, if you had colic, then you're going to have gluten sensitivity or celiac disease or some other type of autoimmune disease. But if we start evaluating and looking at patients, talking to them, we discover that there is a strong correlation. And at the very least, if you did have colic as a baby, there is a very high chance that you have some issues that I'll get into and why you have a very high likelihood of having some type of gut issue. Now, because you're at a higher risk, it's very important that you actually have something done about this, and you don't have to go to a doctor. You don't need some type of test to be done. That's just kind of overkill. And what is also important to know that if you do go for a gluten sensitivity test, there's a lot of times you can have a false negative where it shows that you are negative for gluten sensitivity, but nonetheless, you have gluten sensitivity. You perform an elimination diet, take gluten out of your diet, and all of a sudden you start having miraculous things happen to you. You know, maybe it's better digestion, relief of irritable bowel syndrome, maybe it's increase in your mental health. So what you need to do, that you owe yourself to do if you had colic as a baby, I would highly recommend to you that you go on an elimination diet. And at the end of this video, I will point you to an elimination diet either from someone else, or eventually I will do a video and you can check it out. I'll post this at the end. But doing an elimination diet, at the very least, try going on an elimination diet of gluten. An elimination diet is where you start with the bare bones. You basically strip out everything that could be problematic. Some people even start at a low level of bone broth and slowly add foods as you go. And that way, each time you add a food, you can determine very quickly if you have a problem with it. So we slowly introduce foods back in, and then, oh, look at that. That one's a problem. I introduced kale into my diet, and all of a sudden I'm having really bad reactions. You know, whatever it may be. Sometimes we have very strange food intolerances or allergies. Let me just go over some of the symptoms and characteristics that colicky babies have. I think this will help illustrate to you why there is a higher likelihood of having gluten sensitivity, of having celiac disease, of having gut permeability, leaky gut syndrome, which then kind of spawns into autoimmune disorders and mental health issues. Now, these symptoms and characteristics, these are all scientifically based. I'm going to link to a paper that I'm referencing from, and you can go into this. It's a paper in and of itself from a peer-reviewed journal. It also contains many other studies that it cites as well. So this is a great source for you to dig in deeper if you would like to. Now, the first characteristic I'll talk about is a disruption of the gut microbiota, or a gut microbiota dysbiosis. If that terminology is way over your head, I'm going to break these terms down for you so it's a little bit easier to understand. So in your gut is colonized by bacteria. We need bacteria. These are commensal organisms. They help us with so many things. They regulate our immune system, our mood, all these different functions. We have co-evolved with bacteria and other microorganisms. We have billions And we have billions of these bacteria in our gut lining. And so there's certain species, we kind of have to have a good microbiome will contain certain species. And if you don't have certain species, or you have too many of a certain species, it's called dysbiosis. You don't have a good balance and a good spectrum of bacteria that would correlate with good health. So the next thing is barrier alterations. So what that means is that the barrier to your gut, there's alterations in it. Your physiology, your anatomy has a barrier issue in your gut, which means that you're leaking out proteins and other foods before they're properly digested, things of this nature that results in these issues that we're talking about. They also notice mild gastrointestinal inflammation, and there's going to be some evidence of some biomarkers that display this or evidence this that I'll mention here in just a second. Now we also have something called visceral hyperalgesia, which means abnormal sensitivity to pain. Now how did they determine this? They actually took fecal matter from a colicky baby and they introduced it to rodents. And the rodents started having the same thing. They started having hyperalgesia. They had intense pain. They had hypersensitivity to pain. Now they suspect that this is due to certain bacteria species that are more prevalent in colicky babies that aren't in normal babies. Now another thing that they suspect is that there is a lower rate of colonization within the gastrointestinal tract, and there's a lower diversity. There are not We want this nice, thriving community of microorganisms, of bacteria. And so in colicky babies, they don't have a very good diversity. There are much fewer species of bacteria than a normal child. Now there's also a lower incidence of bacteria species that produce butyrate. Now butyrate is very important, and one of the reasons that there's a lot of people that say the bulletproof coffee is really good is because you use butter that's derived from milk taken from grass-fed cows that have this high amount of butyrate, and it is very good. It's good for your gut bacteria. It's good for your microbiome. It's kind of feeding material for good bacteria, and it also is really good for the brain. They also found that there was a higher amount of E. coli bacteria in the microbiome of colicky kids versus normal kids. Now E. coli, don't think of the foodborne illness. We all have E. coli in a certain subspecies of E. coli in our gastrointestinal tract or GI tract, so that's normal. But what is abnormal is when it's out of balance, when we see an abnormal increase of the amount of E. coli that's colonized within the GI tract. In colicky babies, we also see an increase in proteobacteria that increase gas and inflammation. Now, Klebsiella is one of these. This is perhaps one of the most suspected organisms or bacteria that they think that is contributing to this pain, inflammation, gas, bloating, distension, and perhaps even this, what they called visceral hyperalgesia. Now, as I mentioned before, there is chronic inflammation in these colicky infants. And this is evidenced by a twofold increase in calprotectin levels within fecal samples. So what's interesting about colic is that there isn't really, the etiology is unknown. Etiology just means the cause. What is the cause of this? Now we can kind of, as you can see, there are some characteristics and some symptoms and some things that are going on that are suspected to maybe contribute to this or cause it, but there isn't a definitive cause. So what I think is very important as someone with a very high amount of education, I have a degree both in biology and a doctorate in the practice of pharmacy, I still find that it is extremely important to know that just because there isn't scientific papers out there doesn't mean that we can't benefit from something that others are having success with, that maybe is unknown at the time, that isn't well researched, that nobody really wants to research or is given funding to research. So as we kind of go on into the future, it's becoming more and more important, and we see this even evidenced through YouTube videos and people showing like, oh, I did this for 30 days and this for 30 days. And so challenging yourself, it's called like an N of 1. You performing the test or the research on yourself. So I encourage you, I give you a challenge. If you did have colic as a baby, I would highly recommend to you that you at least eliminate gluten from your diet and see what happens. Do this for 2 weeks, ideally 30 days. Usually people will notice a huge difference with just in usually 3 to 7 days. Some people it takes longer. Now another thing is that there are a lot of food intolerances that you may have. There seems to be a correlation between children with colic and food intolerances or food allergies. So you may want to try a full-on elimination diet. So I hope that this video was useful to you. I'm kind of curious how you got here. Did you have colic as a baby? Tell me about your experience down in the comments below. Are you researching this for someone else? Just give me some information about what brought you to this video. I'd be very interested to know, and maybe we can start a discussion. And if you did find this video helpful, if you found it informative, if it gave you some clues to kind of go down the rabbit hole with and maybe hopefully make some positive improvements in your life, please give this video a thumbs up. Now the other thing, if you are into looking your best, feeling your best, maximizing your potential as a happy, productive human being, then subscribe to this channel for daily videos so I can help you achieve that. I will leave it at that. Thank you for watching, and I will see you in the next video. Take care and to your health.